So what we're going to move into next is the open discussion. I don't know where this is all going to go. There is so much information to cover. There are so many topics to discuss. We're going to try and get as many of them discussed as possible. We've literally got this room till 2 o'clock p.m. Eastern Time. We'll take up the time if we need to. When this group grew from 3 to 6 to however many we got now, I was highly concerned about overlapping of information, repeating of it. Now, some points need to be repeated. I don't think we've seen that here, and I really appreciate that. I would, as we go forward, it's kind of a standard phrase in the United States Senate. If you're in what I call cattle call types of presentations, like you finally get up there and say, I know everything's been said that needs to be said, I just haven't said it. So try and resist that temptation. I've got a series of questions. I know you all submitted questions. I'm going to start going through mine because mine really come from the standpoint of just a non-medical professional. And also from my constituents who asked me the same question. So we'll start there, but I really encourage all of you, if there's an important point that we're missing that is allied with a particular subject, what I want to do is I want to try and group these things together. So we're just not talking about early treatment on one hand, then hospital treatment. I'm going to go through this in an organized fashion based on Dr. McCullough's 4 pillars. So we'll start with the limiting spread, but just kind of the basics of the virus, what we know. But again, I want you to hop in. If you want to be recognized, just flip your name tag, and then I'll recognize that. Audience members can speak to my staff if you want a seat at the table here. But audience members, again, we want to keep all this succinct. And doctors and professors, also keep your answers pretty succinct so we can keep moving. Somewhat organized, but not totally. Let me start with a question that's been on my mind that's never been answered adequately. When I got COVID in September of 2020, I had no symptoms. The only reason I got tested was because I have contact with the public and I would do preemptive testing frequently. All of a sudden, at one test, I was positive. So I went home, afraid, concerned. I mean, I did the things, things like my mouthwash, something we never talked about here, Zicam. I hate to push. That's what I did. Okay, I did the vitamin C's. I did the zincs. I did all that stuff. I don't know if that helped or whether I was just one of the lucky members of the public that was asymptomatic. Here's the question. Why were so many people that were tested positive for COVID asymptomatic? Dr. McCullough.
There's a tremendous spectrum of symptomatology in COVID-19 that there are determinants including the individual, and Dr. Bhattacharya mentioned age is a huge determinant of symptomatology, from no symptoms at all, a younger type of senator, all the way to extreme symptoms and death in the very elderly and frail. Part of that determinism is layered onto it comorbidities. Dr. Parks went over this. Obesity amplifies the syndrome, diabetes, heart disease, kidney disease. So the presence of other diseases amplifies symptomatology and consequences. And then leading research suggests that not everybody can actually get COVID-19. The CDC has always said about 15% of people can't get COVID-19, and it may be protective factors such as the microbiome, the local organism content in the nasopharynx and oropharynx plays a role. It's contiguous to the microbiome in the gastrointestinal tract. One of the things we've learned that we can leverage on this is the use of nasal virucidal washes. You mentioned gargles. There are now 12 clinical trials using dilute povidone iodine or dilute hydrogen peroxide as an intentional, very thorough nasal wash and oral gargle that dramatically reduces the percent positivity of PCR. It drops the intensity and duration of symptoms and improves outcomes, randomized trials included.
Senator.
Yeah, Dr. Urso.
Okay. Your question sort of begs the answer to, does asymptomatic transmission occur? That's basically what you're saying. You were asymptomatic at the time? Okay. So that has never been the driver of a pandemic or an epidemic of any kind. Asymptomatic transmission has been used during this pandemic to create fear over and over. Asymptomatic transmission, if you look at the studies that have been done, I think there's like 7 or so, basically asymptomatic transmission is responsible for less than 1% of cases. What you do see in people who are asymptomatic, quote unquote, is when they convalesce at home, an interesting phenomena sometimes occurs where the other family members and other close contacts also become asymptomatically, in a sense, they convert their T cells, and you can measure their immunity. But my point is that asymptomatic people, and I think this has been a fear for many in this country, that asymptomatic transmission is occurring. And so I think the answer to that is it is not a driver of this pandemic, and it's been a driver of fear. And I think it's important to let that be known.
So one of the concerns, or I think one of the things that we learned, is all the shutdowns drove people to confine themselves in their home, and with a virus that's spread through aspiration, probably the worst response. I mean, is that basically true?
I'd like to have Paul Alexander just recognize your work and your scholarship on all the public health measures you've analyzed in your work.